Hello and welcome. I'm Dr.robin Berzin. I've spent years helping patients uncover the hidden roots of their health challenges, especially when it comes to chronic conditions like liver disease. Today, I want to talk to you about something that most people overlook. It's something you see every day when you look in the mirror but probably never think twice about. I'm talking about your skin. Your skin is more than just a protective layer. It's a reflection of what's going on inside your body. And one of the most common organs that speaks through your skin is your liver. When the liver is struggling, it doesn't always hurt. It doesn't always give you a loud warning, but it does give you clues. And some of those clues show up right on your skin. In this guide, I'm going to walk you through 8 strange skin signs that could indicate your liver is damaged. These are symptoms that are easy to miss or misunderstand, but they matter. Paying attention to them could change or even save your life. Let's begin with the first sign. 1. Yellowing of the skin and eyes. One of the first and most obvious signs that something may be going wrong with your liver is a yellowish tint to your skin or the whites of your eyes. This condition is called jaundice. As a functional medicine doctor, I have seen many patients who never imagined that this slight color change could be a red flag from their liver. Here is what happens. Your liver is responsible for processing and eliminating a substance called bilirubin. This is a yellow pigment that is produced during the normal breakdown of red blood cells. In a healthy body, your liver filters out bilirubin and helps move it out of the body through your stool. But when your liver is not working properly, bilirubin builds up in the blood, and that buildup is what gives the skin and eyes a yellow color. You might think this only happens in very sick people, but that is not true. I've had patients who looked perfectly healthy except for a slight yellowing around their eyes or cheeks. Many brushed it off as tiredness or even poor lighting, but in reality, it was their liver waving a red flag. This symptom is especially concerning if it is also accompanied by dark-colored urine or pale stools. Both are signs that bilirubin is not being processed properly. And if this is happening, you could be dealing with hepatitis, cirrhosis, or a blockage in your bile ducts. Sometimes jaundice is caused by something other than liver damage. Conditions like hemolysis, where red blood cells break down too quickly, or gallstones can also cause it. But no matter what the cause, jaundice is never something to ignore. If you look in the mirror one day and notice a yellowish hue in your eyes or skin, please do not wait to see if it goes away. This is your body asking for help, and the sooner you respond, the more likely you are to avoid long-term damage. Now that we've covered jaundice, let's talk about another unusual skin sign that can be just as telling. 2. Spider angiomas. Now let me share something that often surprises my patients. Have you ever noticed tiny red spots on your skin that look like little spiders? These are called spider angiomas. They are small, bright red dots with thin blood vessels radiating outward from the center, like a spider's legs. You might find them on your face, neck, upper chest, or arms. When I see multiple spider angiomas on a patient, especially an adult who isn't pregnant or taking hormone medications, I immediately start thinking about the liver. Spider angiomas are formed when the liver has trouble processing hormones, especially estrogen. You see, the liver plays a major role in hormone balance, but when it's damaged, estrogen levels can rise. That hormonal imbalance causes changes in your blood vessels, leading to these little red marks. Now I want to be clear. Having 1 or 2 of these isn't always a cause for alarm. Healthy people can develop them occasionally. For instance, they are common during pregnancy or in people taking birth control because of those same hormonal shifts. But if you start seeing several of them, especially in combination with other symptoms like fatigue or yellowing of the eyes, that's when it's time to investigate further. I once had a patient who noticed several of these red spots on her upper chest. She thought they were just part of aging or sun damage. But after further testing, we discovered early-stage cirrhosis. Because she caught it early, she was able to make lifestyle changes that help prevent serious complications. This is why I always encourage people to look closely at their skin. Spider angiomas may be painless, but they are not meaningless. They are a quiet whisper from your body, asking you to pay attention. And now that you know how to spot them, let's look at another subtle clue your skin might be offering, a sign that often shows up right in the palms of your hands. 3. Red palms, palmar erythema. One of the more unexpected skin signs I often point out to patients is something called palmar erythema. That's the medical term, but all it means is this: unusual redness in the palms of your hands, especially around the base of your thumb and pinky finger. When I meet with patients and shake their hands, I sometimes notice this redness right away. And while it's not painful, it is telling. It can be a strong clue that the liver is having trouble keeping up. Let me explain why this happens. Your liver is responsible for filtering and balancing many substances in the bloodstream, including hormones and metabolic byproducts. When the liver is damaged, those substances start to build up. That imbalance can affect blood flow and vascular function. The result is increased circulation in small blood vessels just beneath the skin of the palms, creating that characteristic redness. Red palms are not exclusive to liver disease. They can also show up during pregnancy or in conditions like rheumatoid arthritis and thyroid disorders. But when I see red palms along with other symptoms, such as fatigue, spider angiomas, or yellowing of the skin, my concern for liver health rises significantly. It's not unusual for someone to go months or even years without realizing this change. That's because palmar erythema develops slowly. It doesn't hurt, it doesn't itch, and it doesn't look alarming at first glance. But as a physician, I know better than to ignore it. I once had a male patient in his early 60s who came in because his hands felt unusually warm. He had no idea that the redness in his palms might be linked to his liver. After a full evaluation, we discovered the early stages of cirrhosis. The palmar erythema was one of the first signs, and luckily, he caught it in time. So I always tell my patients this: look at your hands. Notice the changes. Your body is always trying to communicate. Sometimes it does so quietly. But if you listen carefully, you can hear the message. Next, we'll talk about a symptom that is more frustrating than visible, but just as important to pay attention to, and that is chronic itching. 4. Itchy skin, pruritus. Imagine this. You are lying in bed at night trying to fall asleep, but you can't stop scratching. There's no rash, no redness, no insect bite, just a deep, persistent itch that won't go away. If this sounds familiar, it might be more than just dry skin. It could be your liver trying to tell you something. This kind of itching is known as pruritus. In my practice, I've seen many patients, especially older adults, complain about unexplained itching that has slowly worsened over time. When typical treatments like moisturizing creams or allergy medications don't help, I start to consider the liver. The connection between liver health and itchy skin is surprisingly strong. When your liver is damaged, it can no longer properly process and eliminate bile, a digestive fluid that also carries waste. Instead, bile salts build up in the bloodstream. These salts can then settle into your skin, triggering that maddening itch from the inside out. What makes liver-related itching especially frustrating is that it often appears without any visible rash. The skin looks normal, but the sensation is anything but. Some people feel it mostly on their arms, legs, or back. Others say it moves around or becomes unbearable at night. And the longer it lasts, the more likely it is to interfere with sleep and mental well-being. Scratching too much can also damage the skin, leading to redness, bleeding, or infection. I have seen patients come in with raw, painful areas on their arms and shoulders, thinking they had an allergy, only to discover the root cause was liver dysfunction. Of course, not all itching means you have liver disease. It could be caused by stress, dry skin, or even kidney issues. But when itching is persistent, severe, and not explained by something obvious, it's time to investigate. If it shows up alongside other signs like fatigue, jaundice, or red palms, the liver becomes a top suspect. There are treatments available that can ease the itch, but more importantly, we must treat the underlying liver condition. The sooner we act, the better your outcome will be, and the sooner you'll be able to sleep peacefully again. Now, let's move on to a sign that can be both surprising and concerning, especially if you bruise easily without remembering how it happened. 5. Easy bruising. Have you ever looked down and noticed a dark bruise on your arm or leg, and you couldn't remember bumping into anything? If that starts happening more often than usual, it might not just be clumsiness. It could be your liver waving another warning flag. The liver has many jobs, and one of its most important roles is helping your blood to clot. It does this by producing special proteins that your body needs to stop bleeding. When your liver is damaged or under stress, it may not produce enough of these clotting proteins. The result is simple. Even a small bump or light pressure can lead to a large bruise. I remember one of my patients, a woman in her late 50s, who came to see me because she was concerned about bruises that kept appearing on her thighs and forearms. She thought maybe her skin was just thinning with age, but after running tests, we discovered early signs of cirrhosis. Her bruising was one of the first clear indicators that something was wrong beneath the surface. Of course, there are other reasons people bruise easily. Blood-thinning medications, vitamin K deficiency, and certain blood disorders can all contribute. But when easy bruising occurs alongside other liver-related symptoms, like jaundice, fatigue, or itching, it's time to dig deeper. One clue I always look for is whether the bruises appear more frequently or take longer to heal than normal. If your body is struggling to repair itself, it could be due to reduced clotting ability, and that can be dangerous if not addressed. Left unchecked, severe liver dysfunction can even lead to internal bleeding, which is a medical emergency. If you've noticed this change in your body, don't dismiss it as a part of aging. Your body is wise. It's showing you signs so that you have the opportunity to act before things get worse. When caught early, many liver conditions can be managed or reversed, but ignoring these small signs allows damage to continue silently. Next, I want to tell you about a different kind of skin change. It might not hurt or itch, but its color and texture are unique, and when it appears, it almost always points to a deeper imbalance. Let's talk about xanthomas. 6. Yellow bumps. Xanthomas. Sometimes what appears on your skin isn't just a cosmetic issue. It's a message from your body about deeper imbalances. That's especially true when it comes to yellowish bumps known as xanthomas. These small, soft, and often slightly raised patches can appear on your eyelids, joints, elbows, hands, or feet. They're not painful, but they're hard to miss once you notice them. When patients ask me what these yellow bumps are, I explain that xanthomas are caused by the buildup of cholesterol and fats under the skin. And one of the major organs involved in managing fats in the body is, you guessed it, the liver. When the liver is functioning well, it helps process and regulate cholesterol. But when it's damaged, those fats can build up in the bloodstream. Over time, some of that excess cholesterol gets pushed into the skin, forming visible xanthomas. I once treated a patient who was embarrassed by the soft yellow patches that had started showing up around her eyes. She assumed it was just part of getting older, but after some blood work, we found her cholesterol levels were dangerously high, and her liver enzymes were elevated too. It turned out her liver was no longer efficiently processing fats, and that was the hidden cause behind the bumps. Xanthomas are most commonly associated with high cholesterol and diabetes. But when they appear suddenly or in clusters, I always check liver function. In some cases, these bumps can signal a type of liver dysfunction where fat metabolism is disrupted, like non-alcoholic fatty liver disease. Even though xanthomas are harmless on their own, they're never something I ignore. They are the skin's way of pointing to a bigger issue. Left unchecked, high cholesterol and poor liver function can lead to cardiovascular problems, organ damage, and even life-threatening complications. The good news is that when we address the underlying cause by supporting the liver, adjusting the diet, and sometimes using medications, these yellow patches often fade over time. But ignoring them or trying to treat them just on the surface will never be enough. Up next, I want to talk about two changes that often go hand in hand. One affects how your skin feels, the other impacts how your hair grows. Both are rooted in the liver's role as your body's internal regulator. 7. Dry skin and hair loss. There's something I often hear from my patients, especially women over the age of 50. They'll say, "No matter how much lotion I use, my skin still feels dry." Or, "My hair is thinning, and I just don't know why." Most people assume these changes are simply a natural part of getting older, but sometimes the real reason lies much deeper, inside the liver. Your liver plays a key role in maintaining balance throughout the body. It helps process fats, absorb nutrients, regulate hormones, and keep you hydrated at the cellular level. When the liver is under stress or damaged, all of those systems are affected. That's why dry, flaky skin and hair loss can both be signs of liver dysfunction. Let me break it down for you. One of the liver's jobs is to help the body metabolize fat-soluble vitamins like A, D, E, and K. These vitamins are essential for healthy skin and hair. Without them, skin becomes rough and dull, while hair turns brittle, lifeless, and begins to fall out. At the same time, a struggling liver may have trouble regulating hormones, which further disrupts hair growth and skin repair. I had one patient in her early 60s who came to see me because her skin felt tight and dry no matter what she used. She was also noticing more hair in the shower drain than usual. We ran some tests and found that her liver enzymes were elevated, and she had low levels of vitamin D and E. Her symptoms weren't random. They were directly connected to her liver's declining ability to do its job. What's especially tricky is that these symptoms don't usually show up overnight. They creep in slowly. Your favorite lotion stops working. Your hair starts thinning little by little. Before you know it, you're buying expensive creams and shampoos without getting results, because the problem isn't on the outside. It's on the inside. Now, I want to be clear. Dry skin and hair loss can happen for many reasons. Stress, thyroid disorders, menopause, harsh weather, or poor nutrition can all play a part. But when these symptoms persist, and especially when they're paired with signs like fatigue, itching, or bruising, it's time to look closer at the liver. There's good news, though. When we support the liver by improving diet, reducing toxins, staying hydrated, and correcting nutrient imbalances, both skin and hair health can often be restored. I've seen it happen more than once. Let's now turn to the final physical sign on our list. It's one that literally makes the skin thinner and more delicate. And when it appears, it's often a sign of advanced liver distress. 8. Thinning of the skin. If you've ever noticed that your skin is starting to look almost translucent, with veins more visible than before, or if a slight touch leaves a tear or bruise, you might be experiencing skin thinning. This change can be a natural part of aging, but it can also signal something deeper. And yes, once again, the liver may be involved. The skin is a living, breathing organ. It relies on proteins, nutrients, hydration, and hormone balance, all things the liver helps regulate. When liver function begins to decline, so does the production of critical proteins like albumin, which helps maintain the structure and integrity of skin tissue. Without enough of these building blocks, the skin starts to break down. It becomes thinner, more fragile, and slower to heal. In patients with advanced liver disease, particularly cirrhosis, this thinning becomes more noticeable. I had a gentleman in his 70s who came to me because his skin tore easily, especially on his forearms and hands. He thought it was just part of getting older, but after running labs, we discovered a significant protein deficiency, and his liver enzymes were far outside the normal range. Another factor that plays a role in skin thinning is hormone imbalance. When the liver can't properly clear excess estrogen from the body, that hormone builds up in the bloodstream. Higher estrogen levels can contribute to weakened connective tissue and poor skin resilience. This is one reason why people with liver disease often show multiple overlapping signs, from spider angiomas to red palms and skin thinning, all connected by a single underlying cause. What makes skin thinning especially dangerous is how easy it becomes to injure yourself. Everyday activities like gardening, bumping into furniture, or even pulling up your sleeves can lead to cuts, scrapes, or bruises that heal slowly. And because the liver is also involved in clotting, even small injuries can bleed longer or become infected. It's important to understand that thinning skin doesn't mean your liver is failing, but when it shows up along with other signs like jaundice, itching, or fatigue, it points us in a specific direction. It tells us that your body is under stress, and your liver may need support. Now that we've walked through all 8 skin-related signs, I want to talk to you about what to do next. Because recognizing these symptoms is only the beginning. The most important step is learning how to respond and how to support your liver before more damage is done. If you've recognized one or more of the signs we've talked about today, yellowing of the eyes, spider-like red spots, red palms, persistent itching, bruising, yellow bumps, dry skin, hair loss, or thinning skin, I want you to know this: you are not alone, and there is something you can do. Your body is not trying to confuse you, it is trying to help you. These skin changes are not cosmetic, they are clues, they are messages, and when we pay attention to them, we give ourselves the best possible chance at healing. As a doctor, my message to you is simple. Do not wait for these symptoms to get worse. Early detection is your most powerful tool. The sooner we understand what's going on with your liver, the sooner we can begin to support it, and in many cases, reverse the damage. Here are a few practical steps you can take, starting today. First, drink plenty of water. Hydration helps your liver flush out toxins and keeps your skin healthy. Aim for at least 8 glasses of clean water daily, and even more if you're active or living in a hot climate. Second, stop drinking alcohol. I cannot stress this enough. Alcohol is extremely hard on the liver, especially if it's already struggling. Cutting it out completely gives your liver the break it needs to begin repairing itself. Third, nourish your body with liver-supporting foods. Focus on whole, unprocessed options like leafy greens, cruciferous vegetables, berries, citrus fruits, lean proteins, nuts, seeds, and whole grains. Avoid fried, fatty, and sugary foods, as well as heavily processed snacks and meats. Fourth, move your body. Gentle movement helps circulation, improves digestion, supports detoxification, and reduces fat buildup around the liver. Walking, stretching, yoga, and dancing are all great options, even if it's just 20 minutes a day. Fifth, manage your stress. Chronic stress doesn't just affect your mood. It impacts your hormones, your sleep, your skin, and yes, even your liver. Take time to breathe deeply, pray or meditate, journal, garden, or simply enjoy silence. Your nervous system needs rest just as much as your liver does. Sixth, protect your skin. Use a gentle, fragrance-free moisturizer if you're dealing with dryness or itching. Avoid long, hot showers and switch to mild, non-irritating soaps. If you're spending time outdoors, wear sunscreen and long sleeves to prevent sun damage, which can worsen thinning or fragile skin. And finally, see your doctor. If you've noticed a combination of these skin signs or feel that something is just not right, ask for a full liver panel. Blood tests can reveal enzyme levels, cholesterol balance, and other markers that help us understand your liver's condition. Early action can make a world of difference. Let me leave you with this thought. Your skin is your story, your liver is your engine, and both are worth listening to. If you found this information helpful, I invite you to take just a moment to support our mission. Please give this video a like and let me know in the comments which of these signs surprised you the most. Don't forget to subscribe and turn on notifications so you never miss a video that could change your health for the better. Stay informed, stay healthy, and I'll see you in the next video.